Hi, I'm Dr. Reinhardt at Briar Patch Veterinary Hospital. I want to talk to you today about some concerns that are commonly voiced about having anesthesia for a dentistry procedure for your dog. And my assistant Jet is going to ask me some questions, and I'm going to answer them as best I can to help.
Dr. Reinhardt, why does my dog need anesthesia for a teeth cleaning?
It's a good question, and something that we talk about a lot. We have to do a lot of things in the dog's mouth that they wouldn't let us do if they were awake. We probe and check every single tooth, just like your dentist does. We x-ray all of the teeth, and so we have to put a pretty expensive x-ray equipment inside the dog's mouth that we have to make sure that they don't bite, so that's important. And then probably the most important part of that is the cleaning involves a lot of water, and we want to make sure that the water is not swallowed inappropriately or inhaled into the respiratory system, which would be really, really not okay for that patient.
How is the anesthesia administered to my dog? Are they monitored while it's being given?
Absolutely. So our patients are always given sedation medications and then induced into anesthesia, and an endotracheal tube or a tube down the airway is placed and to protect that airway from all of that water and things that we're doing around the mouth. And then the anesthesia is delivered by gas, so inhaled anesthesia. There is a dedicated technician monitoring all of the vitals the whole time that the dog is anesthetized, so we're checking temperature and heart rate and respiratory rate and their oxygenation rate and their EKG, and all of these things are happening continuously during anesthesia.
I've heard some vets offer anesthesia-free dental procedures. Is this true?
It's true that they offer them, but we often discourage considering that route. These procedures are done sometimes with some oral sedation where you give a medication by mouth to make the pet a little bit sleepy, or sometimes not at all. And then the pet is held kind of swaddled or held securely to have their teeth scraped with a dental scraping tool while they're awake. And that can be scary for a lot of pets. It can also easily cause injuries or troubles where we don't need them. But I think the most important thing is we're not doing a thorough examination of the teeth. We're not seeing problems under the gum line, and we're not really treating the majority of the problems that pets can have with dentistry.
Why are antibiotics and pain medications sometimes prescribed for dog dental procedures?
It's also a good question. So pain medication, that's an easy one, right? Anytime we're doing an extraction or we're doing any kind of surgery in the mouth, that's painful, and we really need to send home pain medication for those pets for a few days. Antibiotics, we don't send home very often, but if there's a lot of infection involved, or we've had to do some extensive surgical procedure that we're worried about the normal bacteria or abnormal bacteria in the mouth causing a problem, then we will send antibiotics home for those pets as well.
How do I know if my dog will have a reaction to anesthesia?
Well, I think the true answer is we don't know right away until we do it, but we take every step possible to avoid having any concerns for anesthesia. Every one of our pets that has a anesthetized procedure at Briar Patch has full lab work ahead of time. We also are checking a pre-surgical EKG to check for heart concerns for every patient. We are, of course, doing an exam prior to that day, and again that same day doing another exam to make sure that we don't see any concerns. And if there are concerns, then we will work those up, and we will figure those things out before we do anesthesia for that pet.
Is it possible that my dog could be too old for a dental cleaning?
Well, no is the short answer. So we take all of those precautions so that we can do dentistry on our older patients. Those are most often the patients that actually need the most dental care. And if we let those dental concerns go without managing them because we're worried about age, then we actually can prolong pain and infection in their mouths. So we can talk about that in regards to your personal pet or your individual pet. If you want to bring your pet in and have an appointment, absolutely happy to discuss your concerns about those things. Give us a call at the office and we can get that scheduled.